Case summary and post-surgical follow-ups of bilateral cleft of the lip and palate infant. This slide shows baby born with complete bilateral cleft of the lip and palate. Birth date is reported as 8th October 2019. The slide shows baby in the newborn stage, the front view, the right side view, and the left side view. This slide shows molding therapy with ring plate nasal stent device. The NAM appliance inserted in baby's mouth. NAM is abbreviation of nasoalveolar molding. The slide shows treatment in progression stage. This slide shows the outcome of NAM therapy with ring plate nasal stent device. Retracted and well-aligned premaxillary segment consequent to ring activation. Nasal dome elevation normalizing nostril anatomy results from nasal stent activation and advancement of the medial and lateral crus of the major alar cartilage towards nasal tip projection as an effect of nasal stent activation. Contouring of the lateral alar cartilage into convex form, which was flared at birth, again results from nasal stent activation. Columella and prolabium length increase, an effect from the combined action of ring plate nasal stent device. Nasolabial repair. On completion of molding therapy, the infant was referred to the plastic surgeon for nasolabial repair, that is rhinoplasty and cheloplasty. Lip repair and nostril repair was accomplished by Dr. Tahir Ayub, Assistant Professor Plastic Surgery. He is our current team member. Lip repair is reported as Nude-Hoff bilateral lip repair technique with Tajima nose correction for nostril repair. For palatal closure of this child at age 1 year, surgical procedure used was Bardic repair, two-flap palatoplasty with tensor and levator muscle alignment. Post-surgical wound healing 1 week after surgery. 2 weeks after surgery. Post-surgical repair going on. Follow-up 1 year plus. Follow-up 2 years plus. Follow-up 3 years birthday. Follow-up 4 years. Intraoral examination showed caries at different stages, which were restored accordingly. These videos show speech therapy sessions.
One, two, three, four, five. Good. एक ये वाला दोबारा से टैप करें. Very good. दोबारा से. Very good. वो वाइब्रेट हुआ है. नहीं नहीं उड़ाना तो नहीं है ना. खोलें 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 खोलें. मी आपने चीटिंग की है. चीटिंग की है ना. मुझे पता चला आपने चीटिंग की है. मी ये कौन सा साउंड है. चीटिंग की है. अच्छा कोई बात नहीं. मी ये कौन सी साउंड है. कासिम ये कौन सी साउंड है. मी.
This video encompasses the outcome of nasoalveolar molding therapy applying ring plate along with wire nasal stents, and also the outcome of nasolabial repair by plastic surgeon. This intervention device, that is anterior acrylic ring plate with wire nasal stents, was applied on complete bilateral cleft infant named Qasim, the first child of his parents. The anterior acrylic ring retracted the protruded premaxillary segment into alignment. The wire nasal stents with terminal bulbs induced nasal tip projection and elevation of the alar domes. We are deeply grateful to the child's parents for traveling from afar even during COVID and for their active involvement in his treatment. Their commitment and support made the treatment possible and is greatly appreciated. Acknowledgements are due to the plastic surgeon colleague, dental colleagues, associates, and paradental staff, etc. To conclude, this case comprises a longitudinal study of a patient from birth till adulthood involving the management protocol for 4 different stages, that is, newborn or early childhood, primary dentition, mixed dentition, and permanent dentition stage.